course I was scared because I've been so blessed all my life. I've never had any serious health issues.
Bonnie felt a lump in her breast and brought it to the attention of her doctors, who then did a workup with imaging and biopsy and found an early stage breast cancer.
I always self-examine, have for forever, and I found a small lump under my left breast, and I thought, gee, I don't remember ever feeling that before.
The recommendation in terms of self-examination is now to practice something called breast awareness. And so you want to be aware enough about what your breasts feel like at any given point in your cycle so that if there is a change, you would notice it.
Definitely do that often because I hadn't done it for, maybe 2 or 3 months. And I just happened to be laying in bed and felt that. And I thought, that don't sound right, don't feel right.
A healthy diet and exercise regimen are important for overall health and have been shown to reduce the risk of breast cancer. But even women who have an exceptional diet and are extraordinarily active are at risk of developing breast cancer. And so it's really important to get screened every year for the development of breast cancer when it is early and treatable. We tend to recommend the American Cancer Society screening guidelines, which is that women should get annual screening with mammography every year starting at age 40. The U.S. Preventive Task Force recommends every other year starting at age 50 for the average risk woman. Family history is very important when thinking about an individual's risk for breast cancer. Because breast cancer is very common amongst women, it is very common for people to have a relative who's had a history of breast cancer, but we really focus on extensive family histories or if a lot of first-degree relatives have had breast cancers, mothers, sisters, children. Every breast cancer is very different, and so we can really make tailored, personalized decision making for each patient. The way that we approach breast cancer at the University of Colorado is that when patients are diagnosed with a new breast cancer, they see a multidisciplinary team at the very beginning. So they see myself, a medical oncologist who does systemic therapy choices, and a radiation oncologist who talks about the role of radiation therapy, as well as a team of nurses, nurse practitioners, and potentially other providers who might play a role in their care.
You feel really special. That's one thing I really like about it here. You feel like you're special. You're not just a number.
So for Bonnie, we met as a team. We met with Bonnie. We came up with our multidisciplinary care plan, which involved surgery first, followed by systemic treatment. And she's now successfully completed surgery and will be starting on her systemic treatment, which is a non-chemotherapy based treatment. That's a pill she takes every single day that's very effective at preventing the cancer from coming back.
Everybody was so nice. And when you're a little scared anyway, it's really good when you have nice people. It makes you feel a lot more at ease.